Thank you for coming and meeting us tonight for this webinar. We're excited to do Introduction to the Bleeding Disorders Community. You will notice at the bottom of the screen, there is a globe. Please select your language on the globe so that you can hear what is happening. Esta sesión está disponible en español. Haga clic en el globo terráqueo en la parte inferior de la pantalla y seleccione español. I'm very pleased to introduce Sue Geraghty. Ms. Geraghty has 39 years of experience as a registered nurse. Most of that was spent in orthopedics and bleeding disorders. She worked as the nurse coordinator at the University of Colorado, Denver Hemophilia and Thrombosis Center for 25 years, where she retired in 2013. Currently, she's working as an independent consultant in the areas of hemophilia and healthcare education. She has spoken locally, nationally, and internationally, and has been published in many peer-reviewed journals. Her interests within the hemophilia community include the adult patient with bleeding disorders, patient with inhibitors, and orthopedic issues. She's a frequent speaker on behalf of HFA, and we're very excited to welcome her here tonight. If you have questions as we go along, please feel free to put those into the Q&A. And then if there's any technical issues, my colleague Jeanette is working on the back end and is happy to help you if there's any questions with that. So without further delay, take it away, Sue.
Thanks, Heather, for such a nice introduction. I hope those of you who are out there listening will get at least one new piece of information from this talk this evening. That's always my goal as a presenter, is to have you all get one new piece of information or something reinforced that you maybe have heard when you or your child were first diagnosed. So with that, I'm going to get started. Many of you know who HFA is. It was founded in 1994. And it's a national nonprofit organization that assists, educates, and advocates in the bleeding disorder community. So this is was born out of a need for a very patient-centric organization. And I think personally, that's what I feel like HFA is. And then we have to thank all of our sponsors who sponsor many programs for HFA that either fall under Blood Brotherhood, Blood Sisterhood, or the HFA families, which I think is where this talk falls in. So what are our objectives tonight? We want to recognize who is part of that bleeding disorder community, understand what each of those components brings to you in the bleeding disorder community, brainstorm ways you may want to get more involved within the community, and maybe share some things that you have done or some words of wisdom and make some connections with other people. So what is community? When you look at the definition of community, it's any group living in the same area or having the same interest in common. So for us on this Zoom meeting tonight, that interest in common is bleeding disorders. It can be society or the public. We're charged, actually, I feel like, in the bleeding disorder community to educate other people in the public about bleeding disorders. As you all are well aware, bleeding disorders are very rare. Even though we say patients with von Willebrand's are 1 in 100, people are very ignorant about bleeding disorders. And so I think our community goes beyond what I'm going to talk about here tonight and really encompasses anyone you meet or contact in your world and have the opportunity to educate them about bleeding disorders. And then you have a sharing or ownership in common. And again, that ownership in common is the fact that we are all affected somehow by bleeding disorders. So when you think about the bleeding disorder community, it's a very diverse community. So there's a lot of different players in this bleeding disorder community. And community means different things to different people. Some people feel like their community may be centered around just their family alone. Other people may think it's centered around their family, their church, maybe their son's baseball team, and other aspects of the community in which we reside. So we're looking at our family and friends, thus the most personal part of the community. Those are the people we interact with on a regular basis. Then we go beyond that to the HTC staff or your hematologist. And those are the people that we're going to rely on for advice and assistance in managing our bleeding disorder. You may see them once a year if you're a seasoned veteran, or you may see them every 3 months or every 6 months, or you may see them on a weekly basis if you go into the treatment center for your prophylactic infusions. So again, it's very diverse how those people in the community interact with the HTC or your hematologist. On a broader note, there are organizations like HFA and NHF. They both have local affiliations as well as national affiliations. We're going to talk a little bit about the home care company or specialty pharmacy and manufacturers. Those are the people that bring those clotting concentrates to you. And then we're going to expand that medical arena a little bit further to include our primary care provider, dentist. As those of you know, anytime you have to have dental work, it can be cause significant bleeding. And then other medical providers, such as an orthopedist, someone you may be seeing in the emergency room. So there are a lot of people that can impact your care or your child's care within the bleeding disorder community. And then certainly what we hope through HFA is that patients will connect with other families with who are affected by bleeding disorders. So you can see that's a very big, diverse community. Some people will participate in all aspects of this community, and others may participate just with their family, friends, and their healthcare provider. So let's start by talking about the Hemophilia Treatment Center. Not everybody does go to a hemophilia treatment center, but we really, having been a past HTC nurse coordinator, I really do encourage those of you to make some type of connection with your hemophilia treatment center. You don't necessarily have to go there all the time. Sometimes there's a hematologist that you've connected with within your community, but the HTC has a lot of other things besides just a hematologist that they can offer you. However, the members of your HTC staff vary from state to state and from center to center, but in all instances, they are there for you. They're not there for themselves. They want to be there for their patients and their consumers. So please, please, please don't hesitate to reach out to your HTC if you have questions or concerns. That's why they're there. And to be considered a federally funded HTC, the following core teams must be available. So these are the people at that HTC that are available to you and your family. So a hematologist needs to be available 24 hours a day, 7 days a week. Oftentimes, especially if you're calling on nights and weekends, you may not get the hematologist that you are familiar with at your hemophilia treatment center. However, that physician is a trained hematologist and should be able to answer your questions or at least refer you on to someone who can. The nursing staff at the HTC, I think we're the frontline people who work with patients and their families. The number of nurses at the treatment center is going to depend on the size of the center. So if you are at a very small center that only maybe has 150 patients, there may be only 1 or 1.5, maybe 2 nurses. And if you're at a huge treatment center like Indianapolis, for example, there may be 10 or 11 nurses. So again, the nursing staff depends on the number of patients that the treatment center serves. A social worker may be housed within the hemophilia treatment center, or they may be contracted through the hospital. So again, that's going to depend on the size of your treatment center. A large treatment center may have 1, even 2 social workers. I know the treatment center in Denver right now has 2 social workers. Physical therapists, again, they may be housed within the treatment center, or they may be housed within the physical therapy department, but have dedicated time to answer questions and to help those in the bleeding disorder community. And then also a laboratory has to be available that can provide basic testing around bleeding disorders. So if you have other family members who need to be tested, this is where you want to have them make contact with your Hemophilia Treatment Center to get additional testing done there. We hear lots of stories about people who say, oh, well, I went to LabCorp or I went to Quest Diagnostic to have my lab work done and it got all messed up. So rather than have the frustration of having inaccurate testing done for your family members or for yourself or your child, it's best to, at least if you don't go to the treatment center, to have it done, coordinate it through the Hemophilia Treatment Center, because they're able to provide where the best place is for you to go for those kinds of services. Why should you use a Hemophilia Treatment Center? Well, there's a lot of needs and issues that come up at different stages in life. So when you have a new baby with a bleeding disorder, your needs are going to be different than someone who has a teenage son. But that doesn't mean that the teenage son isn't going to have issues that need to be addressed by yourself and the treatment center team. And everything you face may not be medical in nature. We have social workers. The social workers can help you with insurance questions, things like that. And in many instances, they can function as an extension of your core family. And I'm happy to say that I've been invited to a lot of weddings and graduations and all kinds of things like that for my patients, because they actually perceived me as being an extension of their family. And in return, we're very happy to be able to attend some of those life events for them. So you guys need to, make that relationship with your healthcare providers and use them as an extension of your family. We have a lot of local member organizations. Sometimes they're referred to as chapters. Sometimes they're referred to as societies or associations. The name really doesn't matter. What that organization is it's a group of people affected by bleeding disorders and their families. The staff at a chapter is usually made up of volunteers from the community, although the larger chapters often have 1 or 2 paid staff on hand, so that there's always someone there to answer the phone should you have questions or concerns or need a referral to some kind of support. They do provide education. So local chapters oftentimes will have someone like myself or another HFA speaker come out and do an education session, maybe on a smaller scale than this one, or they can also help you with advocacy on behalf of the bleeding disorder community. So when you hear about Washington Days and going to visit your state legislators, oftentimes those are honchoed or set up by your local chapter. They can also help facilitate relationships among patients and caregivers, and they're instrumental in developing and supporting camp programs. And we're going to talk a little bit about those here towards the end of the presentation. Over those local chapters are national organizations, and you all are familiar with HFA. It's open to all families and friends of persons with bleeding disorders. It focuses on the affected person and those who are important to them, and represents the patient's voice. That's why I said at the beginning, I think HFA is very patient-centric. The patient is at the center of everything that they do. NHF has some of the same things, offers some of the same things that HFA does, but in addition to providing those patient-centric things, they also provide support for the medical community. Many of you may have heard of MASAC, that's the Medical and Scientific Advisory Council of NHF, and they're really the ones who set guidelines for the treatment of patients with bleeding disorders throughout the United States. Those are guidelines. Keep in mind, they are not set in stone, and your healthcare providers may not follow them exactly. If you're interested in seeing some of the guidelines that MASAC has put together, you can go to NHF's website and follow the prompts to see some of those MASAC recommendations. And they recommend things like prophylaxis, what should trough levels be, different things like that. So if you have time, sometimes it's worth just kind of going through that website and seeing if there's anything there that interests you. In addition to the two big organizations, though, there are other organizations that support patients in their families within the bleeding disorder community. One is the Coalition for Hemophilia B. That particular organization really focuses on those patients and their families, women as well as men who are affected with hemophilia B and their family members. The Foundation for Women and Girls is just that. It's looking at women with bleeding disorders. And then the Comprehensive Health Education Services often focuses on those patients with inhibitors, although they have several other areas and programming that they do. So if you're not familiar with these, I recommend that if you think you fit into a category where one of these other educational organizations may have some support for you, please, by all means, investigate those. And you can Google them, you can find that information out pretty easily. And most patients affected by the bleeding disorder community have factor at home, or at least know how to acquire factor should they need it. Most of that factor comes to you through a home healthcare company or a specialty pharmacy. And they specialize in the delivery of factor products and other medications and supplies that are needed to treat bleeding disorders. Oftentimes, home healthcare companies also have skilled nursing available to their clients, and they can provide infusion services and do some education in the home, education in your child's school, or other places. But keep in mind that not all companies, not all home health companies or specialty pharmacies do have nursing services available in the area where you live. And also, lastly, you may not have a choice of who provides your child's medication. It can be just simply based on the insurance plan. And I know I've encountered many patients who had a great relationship with their specialty pharmacy or with their 340B program. They changed insurances. This is now the time for open enrollment. So if you don't want to change who your specialty pharmacy is, certainly reach out to the social workers at the treatment center or someone at your home healthcare company, and they can help you make sure that your plan still is able to work with them. We're seeing more and more, however, that insurance companies are just not willing to bend their rules for patients, even with high cost items such as bleeding concentrates. And then another partner in our bleeding disorder community are pharmaceutical companies or manufacturers. They're the ones that actually make the treatment products that we use today. These products are usually distributed through HTC 340B pharmacy or through your home care company. The pharmaceutical companies do not sell directly to patients or their families. However, they do support the bleeding disorder community through the local chapters by giving them grants or sponsoring education sessions or things like that. They are also often at education weekends or other, depending on your chapter, they may be at a walk, they may be somewhere where you can have the opportunity to talk with them about the pharmaceutical products that they have available. They're there to provide you education. They're not there to do a hard sell. If you ever feel like you're getting a hard sell from a pharmaceutical company and you're at a chapter event, please let the chapter people know that happened. These pharmaceutical companies work on research and development. I just did a talk for HFA last weekend, and we looked at emerging therapies, and I cannot even tell you how many products are on the research and development table for those of you with bleeding disorders. And these companies also are the ones that sponsor trial programs. If you want to try a new product, oftentimes there is a trial program available, or they have the copay assistance cards. Again, you need to look at what your state does as far as the accumulator adjuster. Those copay assistance cards may be of help to you where you are, and they may not. So again, that social worker, that member of the HTC team, is the person that you can go to get some of those answers. And most all of these programs, the copay assistance or the trial programs, need to be accessed through a healthcare provider or your HTC. So I'm going to stop, take a little break here. How do you connect with your bleeding disorder community? Whether it was pre-COVID or during COVID, if you want to, you can put something in the chat. If don't feel like you have to. Heather and Jeanette are going to look at it, and if there's anything, they're going to share it with the rest of us. So I'll just be quiet for a minute, and if there's not anything, we'll continue.
I don't see anything right now.
Okay, well then we'll continue.
Thank you.
Ways that you can connect. I mentioned early on about participating in state and local advocacy days, visiting your state capital, communicating with your legislative representatives regarding the needs of the bleeding disorder community. I know several states, that's how come they don't have that accumulator adjuster, is because the members of the bleeding disorder community went to their state legislation and were able to lobby to get that to go away. So again, there's power. And of course, we're talking about this talk on our election day, and I hope everybody out there voted, and your voice does count, even if you don't think it does. So, but having communication and, communicating with that legislative representative, whether it's on a local, a state, or a national level. We never would have got Ricky Ray through if it wasn't for people like yourselves who advocated for those families who were affected by HIV back in the 80s and 90s. If you don't have time that you can give, you can always donate money. Or you can volunteer. It doesn't necessarily, if you're not comfortable dealing with legislative parts of the bleeding disorder community, it's okay to volunteer to stuff envelopes. It's whatever your chapter can use, and reach out to them. Ask them, is there anything that I can do to help? You can sit on the board of your chapter's board of directors. You don't have to be an expert in anything to be part of the board. If that's something you're interested, reach out to your chapter. And then attend local and national meetings and be part of things like you are this evening. Hearing about ways to connect within the community. You may not even think about ways you can connect, but it's very important for those of us in the bleeding disorder community. And you'll find that most of your healthcare providers also will write letters, will advocate on behalf of their patients. And then HFA, of course, has so many different programs that are available to you guys. They have of course, their national meeting, symposium, and there's all kinds of breakouts. They have a resource library. They have an it's called Infusing Love. It's a blog. It's mostly parents. Project Calls is a research project that you can participate in. There's all kinds of things. I'm not going to read them all off of the slide. You guys can see those. But, take advantage of these programs that are out there and organized for yourselves. And you don't have to do them all the time, but you want to try to find something that captures your interest and you're willing to give some of your time and expertise to the other people within the bleeding disorder community. I mentioned earlier, we were going to talk about camps. Most youth camps are supported by local chapters with, sometimes they're done along with other members of the community, like home care companies or specialty pharmacies may provide counselors or things like that. In general, most of our youth camps are sleepover camps for children affected with bleeding disorders. The age varies. Usually, most of the time, 7 to 14. Sometimes camps will have kids come at 6. And then there are often CIT or counselor and training programs that extend past the age of 14. Many camps include siblings. I know the camp I was at through our treatment center here in Colorado had siblings. And it gives both the affected child with the bleeding disorder and their siblings an opportunity to bond with others like themselves. And then so many kids have told us, oh, I don't feel alone. I know somebody else who has hemophilia, or I know somebody else who has von Willebrand's. And they stay in touch. And I can tell you, when we get together, there are many adults who are like, oh, I remember you from camp. We were in the same cabin. So it's really a lifetime, in many instances, a lifelong relationship that is fostered at these hemophilia camps for patients with bleeding disorders. And then there are family camps. Family camps are much shorter than a sleepover camp. They're usually held over a weekend. And the target group varies, but usually it's targeted for those families with young children, so children under the age of 6. And it's an alternative. If 7 is when you can start going to sleepover camp, that this is a camp where you can still participate in camp activities, your children can, but you as parents are still there, and it makes it a little bit easier to cut those apron strings when it's time to go to sleepover camp. And it also gives families an opportunity to bond. It gives them an opportunity to find other patients who may mentor them, or families who are willing to step up and say, oh, when my child was 2, this, and this happened. Or if a family expresses a concern or a question, say, oh, I had that happen and this is how we dealt with it. So it gives families an opportunity to bond and to work with each other. And as I said before, advocacy is hugely important. It's very important to HFA's mission, and it means different things to different people, though. I think the starting point for advocacy is learning to advocate for yourself or your child with a bleeding disorder with other people in this community, whether it be the people at the treatment center, people at your child's school, coaches for your child's sports teams, but it gives you an opportunity to advocate or to stand up for what's going on. And I'm going to stop for a second and see if anybody wants to put anything in the chat about advocating, ways that they've been able to participate in advocating, whether it's been in the community at large, whether it's advocating on a governmental level, or just for themselves within the bleeding disorder community. I'm a slow typer, so I always give people the opportunity to type, but if we don't have anything.
We do have one comment in the chat that says, I have testified at our state healthcare authority for approved medications.
Great. That's the first
example.
That's a great example. And, you know, we're going to see more and more. I was talking to the people I was with this weekend and was just saying, you know, when I started in hemophilia in 1987, there were only a handful of products, maybe 1 or 2 for factor IX deficient patients, 1 for von Willebrand's patients, and 3 or 4 for hemophilia A patients. And so now we have a lot of choices, and some states or insurance companies are starting to limit those choices, and that's a great place for advocacy to come in for the person who said they helped with product. And then go ahead.
We do have another comment that says, my children and I work to support our state program that provides insurance for expensive genetic disorders.
again, another great place to advocate, because hemophilia and von Willebrand's, like I said at the beginning, those are rare disorders. And if we don't educate our community, whether it's legislative or healthcare providers, we need to advocate so that other people out there know about us and know what our issues are. So I think that that's really a great way to do that. And I'm glad your children are also participating in it, because I think that's a good way to set an example for the next generation coming along. I think we can't do everything. And I know that as a retired treatment center nurse, that there are newer, younger nurses that do things different than the way I did them. But that's neither good or bad, but they're taking on the task. They're the next generation coming up. So having your children participate, going to the legislators, you know, a lot of these congressmen and senators, they'd rather talk to your kid and have them tell about their bleeding disorder than to hear parents talk about it. Makes a much bigger impact if you have a child that is articulate enough to speak on behalf of their bleeding disorder. And then
Sue, we do have a comment in the chat that says, my daughter's advocacy efforts stood out on college scholarship applications.
Great area, because there's so many scholarships available to people in the bleeding disorder community. And those are the kinds of things that we look at when we are reviewing applications for scholarships, is how do you participate within the bleeding disorder community, and advocacy for those teens and young adults who are looking at scholarships is a great way. So thanks to that participant for highlighting the scholarship aspect. Anything else, Heather?
There are some questions coming in the Q&A, so I'll just remind people that if they have further questions on any topic, not just this particular question, to add those to the Q&A and we'll answer those at the end. There aren't any more questions specific to advocacy within the community at this time.
Okay. And we're almost to the end. So, and lastly, as I mentioned, mentoring is a big part of the bleeding disorder community. You know what you went through when you first got your diagnosis, and how, if you didn't have a family history of a bleeding disorder, how alone you may have felt, how all these questions are running through your head. You can't sleep at night. What if this happens? What if that happens? And having someone who's been there, who's been through it, and able to mentor you or take you under their wing and say, oh, that's nothing to worry about. Or, yeah, we had that. My son had an intracranial hemorrhage. This is how we handled it. And so this is why we really make sure our son always wears a bicycle helmet. So just passing along small little things can make a huge difference to another family. And not just sharing your victories, and you need to share your challenges and barriers and how you overcame obstacles, because that's how the young, newer family is going to learn, is by seeing, oh, you know, John and Susie Smith did this with their son and it didn't work. But they eventually did this and it did work. So they were able to overcome a barrier, and I'm going to learn from that. So really learn from your peers. And with that, we are ready to take questions. So I'll let Heather or whoever screen the questions, and I'll try to answer them to the best of my ability.
Great. Thank you so much for sharing your time and expertise with us, Sue. We do have several questions in the Q&A, so I'm just going to go down this list. The first question is, what questions should I ask when looking for insurance for myself or my child?
I think you want to find out how they handle medications. First of all, are medications part of the major medical insurance, or are they part of a pharmacy plan? Is there a cap on the pharmacy plan? Is the pharmacy plan tiered? And if they are a tiered plan, and by tiered, what I mean is there's several levels. So say, for example, I'll use myself. I am on a blood pressure medication that is so generic, it's been around since the beginning of time. When I was a nursing student in 1975, that medication was around. So that's a tier 1. It's common, it doesn't cost much. But if I wanted to be on the latest and greatest blood pressure medication, my insurance may say it's tier 3, where I might pay $3 for a tier 1 medication. I may have to pay $50 for a tier 3 medication. So you want to ask those kind of questions. You want to make sure that whatever medications you use, whether it's Lystata or a factor product, that those are covered medications. Also, you want to find out if there's a limited network of providers from which you can choose, and you want to ask if your healthcare provider or your HTC is part of that network. If it's not part of the network of the insurance being offered or that you're looking at, find out what are the rules to get an exception. So those are some of the kind of questions. I hope that was helpful.
Thank you, Sue. Also, I just want to make a note that in the chat, Jeanette put a link to Dateline Live, which is an HFA event happening next week. There will be a session that will answer some questions about insurance in greater detail and have that focus. So please do check out that link or go to our website to get some more information about that particular topic.
Yeah, this is a time, that's open enrollment for many employers and things like that. For those, if there's anybody on Medicare, it's open enrollment for Medicare. So pay attention to that and use the resources that are available, like Dateline. Also, again, the social worker at your HTC can help you negotiate some of these issues or questions and help you. They may be familiar with the insurance you're looking at and know what other patients' experiences have been.
Thank you. The next question is, are scholarships available for young kids to be able to attend a private school?
I'm going to tell you, honestly, I don't know. Most of the scholarships I am familiar with in the bleeding disorder community are scholarships that are for either high or college, trade school, things like that. But just because I'm not familiar with them doesn't mean that they don't exist. So hopefully wherever you are, your chapter puts out a list of all of the scholarships and things available for patients within the bleeding disorder community. And I would just go through them and look what the criteria are for certain ones. There are some scholarships that are only applicable for patients with hemophilia B. There are other scholarships that are only applicable to girls and women who are affected by bleeding disorders. So again, you want to look at what the criteria are for those. But personally, I don't know of any. And Heather or Jeanette, if either of you guys want to chime in if you know of any.
I am not aware of any either, but as Sue said, that doesn't necessarily mean it's not possible. I do think the recommendation to go to your local member organization is a good one, because they often have local scholarships that wouldn't necessarily be listed on one of the national sites, but are definitely available and might be more appropriate at the local level in terms of providing support. The next question is another question related to elementary and daycare age children. The question is, where do we start with protecting our children when they head to daycare elementary school?
That's a good question. And I think every parent has experienced, what do we do now? When you're starting to look at daycare, the biggest thing I would tell patients is visit the daycare center that you're considering putting your child in. Find out what the ratio of care providers to children are. Take a look around the room. Are all the corners rounded? Are there things on the playground? Are the monkey bars over asphalt, or are they over wood chips? Look at things like that. That's a good starting place. And then you can always ask, have you ever had a child with hemophilia or bleeding disorder in your facility? If so, what was the experience like? When you get, once you've made a selection, again, you can talk with your HTC or with your specialty pharmacy to see if they have nurses that can provide education. Oftentimes, HFA has great tools for educating schools, and I would say a lot of times in today's healthcare climate, the education is falling more to the parents. So certainly access those tools that are available through HFA and through your local Hemophilia Treatment Center. They may be able to provide an in-person education session for the people at the school. I was telling somebody this weekend, I had a little boy who lived in a very rural part of Wyoming, and it was about an 8-hour drive from Denver. And I said, I'll come up there and do a school in service, but can you get all of the teachers he's going to have there at the session? And they did. I mean, I gave the in service to anybody that was going to teach this kid from 1st through 12th grade. So, but look at those kind of resources, and, talk again to people at the treatment center. They know if they've had a bad experience with a particular daycare center, or if a family has. So, same with your local chapter or member organization. See if they have any ideas, if they keep a list. I didn't necessarily keep a list on preschools, but I certainly kept a list on pediatric dentists, so I knew who to send people to. So again, use the resources that are available to you. But and HFA's school toolkit is one of the better ones, and it provides you with information that you can then leave with the schools so that they have something to refer to and can pass it around to anyone who may have contact with your child. School-age children, the key people to educate are the classroom teacher, the PE teacher, the paras who may be out on the playground where your child is at recess. And believe it or not, the key person in a school system, and we often overlook them, is the lady in the office. So whoever is that lady in the office, who really, they get to know your children better than sometimes their actual teachers. And oftentimes in this day and time, many schools don't have a school nurse available, but if there is always going to be a school nurse that's going to be over the school. So you want to pull them in and make sure that everyone at the school with your child is comfortable. And a good starting point for that is, have you ever had a child with hemophilia or with von Willebrand's in your school? And then again, making the accommodations, and we can do a whole talk on IEPs and things like that, but there are things available out there where you can make accommodations for your child with the bleeding disorder in the school setting. So again, look at the resources that both HFA and NHF have available to you on those topics.
Thank you, Sue. I'll just mention that HFA recently redid our website, and in the process of doing that, we are revisiting our toolkits to make them even more user-friendly and update the information. So if you're looking for information that's been referenced that you can't find on the website, please feel free to reach out to us on the education team. We're more than happy to provide support or point you in the right direction. I believe the website is incredibly clean and simple and user-friendly, but we are still building content on there. So just excuse us while we try to enhance those resources. And as I said, if there's something that you're looking for that you can't find, definitely feel free to reach out to us. The next question, Sue, is I'm wondering if you can speak as a nurse about informed consent, what that means, what your role is as a patient or as a parent in conformed consent.
Informed consent happens in most institutions. The first time you visit an institution for the year, you are asked to sign a consent, and that is a consent for treatment. And so everyone is usually asked to do that once a year. It may be a form that you fill out at your doctor's office, and read those forms carefully, but that's the first piece of informed consent and that's going to happen to everybody regardless, in some way, shape, or form when you access care from a healthcare provider. So that's the first type of consent that you're going to give. The second type of consent is going to be, oftentimes you're asked who in the community or in your family can have access to healthcare information about your child. Again, this comes up oftentimes with when there are two different custodial families for a child. And then I'm not sure, but I'm thinking maybe the informed consent you were driving at with this question is informed consent around participation in a clinical trial or a research study. Many of you may be approached by either a nurse or a physician or a clinical research assistant at your treatment center asking you to participate in maybe it's an Athens study, the Association for Hematology and Thrombosis. It kind of took over the role the CDC had in terms of doing basic data gathering type of research. So you may be asked to consent. You should be given adequate time to read the consent and to voice any questions or concerns you have about participation in data collection type studies. Then the next type of study would be not just data collection, but participation in an actual clinical trial using a new medication or implementation of an existing medication in a new arena. So again, you need to be given adequate time to read the consent form and to be able to ask questions and have all of your questions answered before you agree to go forward. Some consents or some studies give you a small token of appreciation for participating in a study, and that should be outlined in the informed consent that you're given. So you shouldn't be approached saying, oh, well, we can give you $300 if your child participates in this. It needs to be clearly stated in an informed consent. The way a clinical trial is developed is through something called an institutional review board, where there are physicians from the institution that actually review the clinical trial that you're being asked to participate in to make sure that it's safe and efficacious and that you're not being induced or encouraged to participate because there is an inducement. So it's very fair and clear and above board. That all takes place before you're ever even approached to participate in a clinical trial. And then, you know, again, I can't emphasize enough, you should never feel coerced into participating in a trial. If you're not sure when you're at the visit, when someone approaches you, ask if you can take that consent form home, read over it, formulate your questions, and then either call or have a contact with that researcher, again, before you agree to participate in a clinical trial. Informed consent is the mainstay of asking our patient community to give us your healthcare information and to participate in any clinical trials that could eventually bring a product to market that could benefit the community. That was a long answer, sorry.
It was a long answer, but very helpful. Thank you. I will just add one quick thing, which is from my experience working at a local member organization. I know often people were asked to share their medical information with either a specialty pharmacy or pharmaceutical company, particularly if they attended a dinner or an event that was hosted by those organizations. And they do need to report out the total number of people that attended, but they do not have have to have your information in order to do that. So it is okay as a patient or a parent of a patient to just put an X instead of your information if you don't feel comfortable putting your contact information or any other identifying information on that paperwork. So I just wanted to mention that one point as well. We have one more question in the Q&A. We're almost at the top of the hour. So if you haven't had a chance to put your question into the Q&A, please do so now. The last question is, our doctor hasn't mentioned any infusions or getting factor at home. Should I ask about this, or is there likely a reason that it hasn't been talked about?
Without knowing the age of your child or the diagnosis, I'm just going to answer a little bit globally. So there are many reasons why physicians don't recommend that patients keep factor in the home. And the biggest one of those is that you're in a metropolitan area, you have access to the treatment center or a facility that carries the factor concentrate that you need. And that usually occurs in patients with very mild bleeding disorders. However, that said, a couple of exceptions to that is if you live in a very rural community, where it's a small hospital, they're not going to keep factor on hand. It is within the scope of your rights to ask your healthcare provider. For example, I covered all of Colorado, Wyoming, and Montana, and I can tell you the number of hospitals in Wyoming that have clotting factor is 1. And so think about how big that big square state is out west. And so if you lived in a small town, say Cody, there was no factor concentrate available for you. So if you had to get factor concentrate, you were going to have to travel a great distance. So again, you want to be prepared with your own information when you approach your healthcare provider saying, I live in this small town, I don't have access to clotting factor here. My son is very active, or my daughter is very active in sports, and I would really like it if we had some factor available to us. What can we do to help to make that happen? The other instance where oftentimes patients who don't keep factor, even if they do live in a metropolitan area where factor is available to them, is travel. So you're going to go on a vacation or to Europe or somewhere. It's important that you have the products that you need to treat in an emergency situation available to you. And so it's not maybe that the doctor doesn't want you to have factor, but that they may not understand your need to have factor or why you would like to keep factor at home. So again, communication is key. Ask them why they haven't brought that up. And is that something that they think is something that you would need in the future? You may not need it now, but you may need it in the future. So again, that two-way communication between you and your healthcare provider is essential to establish getting and keeping factor at home. And the flip side of that is oftentimes physicians don't want to prescribe factor in the home setting for patients with mild bleeding disorders because they know how expensive that factor is, and oftentimes it just expires while it's sitting on the shelf. And from a treatment aspect, and we're hearing this more and more actually, patients who don't use those infusion skills regularly oftentimes are not, even though you've been trained to do self-infusion, if you're not doing it, a couple of times a month or more frequently, you lose that skill and maybe forget something, or that's another reason why a physician may be uncomfortable having you have factor in the home. Now, in the case of a rural patient, you may often be taking that factor. You may not be infusing it yourself into your child. You may be taking that factor with you to an emergency room. So again, there's a wide variety of of answers to this question, but I think the place to start is to have that open communication and dialogue with your healthcare provider.
Thank you so much, Sue. It was really wonderful to be able to benefit from your many years of expertise and to give us this overview of the community and answer all of these questions. We very much appreciate it. We have just a couple minutes left, and I just wanted to make sure to communicate some upcoming events through HFA. All of these events and the links and more information are available on that snazzy website that I mentioned earlier, hemophiliafed.org. December 8th is our next webinar, and it is the part 2 of our Unspeakable series. Hopefully you have heard about this, but we are running a 4-part series that discusses the tainted blood crisis in Canada. It's really an opportunity for us to shed some light on a difficult period in our history, either to educate people that have not heard of it before or reacquaint people who have heard of it or who lived through it, and to try to really process what that means for us in the past, present, and future. So that's December 8th. There's also a webinar, excuse me, on December 13th. That's financial and emotional resources for the holidays. We'll have a staff member from HFA from our Helping Hands team talk to us about both some financial ways to find support around the holidays, as well as some mental health resources. So that's on the 13th. And we do have monthly network chats. So community networks like our Blood Brotherhood, our Blood Sisterhood, Sangre Latina, which are Spanish chats for those community members who speak Spanish. Those happen monthly. You can find the link online. They're a really wonderful way, especially for new community members, to become acquainted with other people in the bleeding disorder community and make those connections that we all know are so important. And then lastly, as Sue talked about, we do run our national conference symposium in April. It's happening in Orlando in 2023, and registration will open in January. If you haven't had an opportunity to come to symposium before and you're a first-time attendee, we do offer scholarships. They're on a first-come, first-served basis. So I would just encourage you to really watch HFA social media channels in order to put yourself in the best position to get a scholarship. And then, as I mentioned earlier, if there are any questions about any resources, or you have further questions that you would like us to pass along to Sue, please definitely get in touch with us. And you can reach the education team at hfaeducation@hemophiliafed.org. And thank you again so much, Sue. I hope everyone has a wonderful evening. This recording will go up on our YouTube channel within the next few days if you want to pass it along to friends or watch it again. Thank you.
Thank you for having me. I hope everybody, like I said at the beginning, got one new piece of information. And if that happened, then I did my job. So thanks, and good evening, everyone.
Thank you so much.